Welcome back to our discussion on relative energy deficiency in sport. In this section, we'll explore how REDS affects different populations, how it compares with earlier models like the female athlete triad, and which athletes may be at greater risk. So, Dr. Casey, how does REDS differ from the female athlete triad?
That's a great question. And it's important to understand the history of where all of this, science and understanding come from. So the female athlete triad is a term that was presented to the medical literature in the 1990s. And what sports medicine doctors and sports dietitians, a variety of people, coaches working with athletes saw was that there was this relationship in some athletes where they were under fueling, not getting enough energy intake. They stopped having a period, which is known as amenorrhea. And then they had problems with stress fractures, having multiple stress fractures or taking time for those stress fractures to heal, which all can be related to the bone is not being, is not as dense and as strong as it should be, also known as osteoporosis. So the kind of most severe form of the female athlete triad, if you think about it like a triangle, one side is not fueling enough, then it's not having a period or a menstrual cycle. And that's because we said there's not enough energy, to continue that process, and hormone levels, especially estrogen, drop down, which both of those lead to less strong bones and risk of stress fracture. So that triangle is the female athlete triad. Again, that was in the 1990s. That's been studied extensively, and lots of wonderful research looking into why that occurs and, strategies to help that. And then in about 2014, the concept of relative energy deficiency in sport was introduced. And what it did is it certainly houses the triad, and that relationship between those three things are within the context of REDS. But REDS also talks about there are other body systems that suffer. Immunity, the performance piece, so concentration, coordination, learning new skills, the digestive health, the cardiovascular health, brain health. And so instead of just being these three focused areas, it sort of brings it out to talk about more aspects of health that are negatively impacted with not fueling enough, as well as performance. And that allows people, I think, to understand it in a bigger concept and context, to understand how this really can impact, an athlete's life from all angles.
And not just females.
Actually, great point. Thank you for bringing that up. So certainly it's been shown in other populations. So there's the male athlete triad is now a coined concept where instead of stopping to have the menstrual cycle, there's low libido, changes in erectile function. So that certainly can occur in the setting of male athletes. Other populations have been further explored. So Paralympic athletes, for example, we're starting to understand how the relationship with fueling and sport is important and a bit different and needs to be understood better. So broadening the idea of the concept allows us to understand that this happens beyond just a specific type of female athlete, which is where it started. And it's nice to see that evolution to be more comprehensive so we can educate a broader audience.
And Heidi, do you see a difference between how REDS manifests itself in men and women?
Well, I think just to the point of what Dr. Casey said, there is no way to track it through a menstrual cycle. But so we see it more through low libido, no morning erection. But the other thing that's really, and we're still teasing this out, is it does seem that males do need a more severe restriction of calories, like a lower level, before they see the same manifestation of symptomology and for greater duration, and they're not as sensitive to within-day energy balance as females seem to be. The other thing I really want to highlight, because we've been talking about bone health, is just this idea of, it's not just teenagers, right? This can happen at any stage of life. But when it does happen, which is a group of athletes that are particularly vulnerable to, I think, diet culture and not eating adequately, is that we build our bone banks for the rest of our life. To reach peak bone mass happens through your teenage years. So by the age of 19, 90% of your bone health for life is developed. And then we finish it off in our 20s. So it's really crucial that children and teenagers get in adequate fuel. It's not just an aesthetic thing, and it can affect all of these different symptoms. But this may not be reversible. Like if this goes on, if it's prolonged, and we just talked about the relationship to estrogen and bone health, it can impact bone health for life. So it's not a small thing. It's not just this temporary blip. It really can have, life impacting consequences.
Wow. Now, is low energy availability or REDS more common in certain populations, or are there certain sports or training environments where you feel like there's a greater risk for someone developing this?
Yes, if you look at the research that's been going on for years, the environments or the types of characteristics of an athlete that may make them more likely to develop REDS would be somebody who has a high level of perfectionism or sports that ask for that, such as gymnastics. It may be an environment where there's a lot of emphasis on sort of the aesthetic, lean culture, or the ideas that if you're lighter, you run faster. If you're lighter, you jump higher. There's also sports with weight classes. So, rowing, for example, or wrestling that, might make somebody more at risk because that number on the scale and the worry about not making weight is so high. And then also when the attire is very form-fitting, which again, we would think about, sort of dance and gymnastics. But if you look at women's volleyball over time, the uniforms have changed quite a bit as well. And so what I think is important is, we were talking about the sort of the origins in the female athlete triad, and we used to think this was very specific, a runner, a dancer, a gymnast who's very, thin and at risk for this. But we need to be thinking about this in all athletes, in all female athletes, and all male athletes, because it isn't just a specific look, that I think people used to believe are a specific type of athlete. We should be screening for it in everybody, because the potential to figure out something's happening at an early stage, give some education, and then there's a very different outcome and building bone that people need for the rest of their lives. You can really make a change if you're looking for it and screening for it. So there are characteristics that make someone maybe at higher risk, but everybody is at risk of this and they may not even know it's going on. And so this is something that we screen every athlete we see for.
Well, it makes sense because, to Heidi's point, it could be not intentional. Not
Right.
everybody it would be deliberately restricting calories. It
Right.
could just be this mismatch between
Mhm.
their daily requirements and
Yeah.
what they're actually getting in.
And in fact, that's the most
Yeah.
common situation, wouldn't you say,
Oh,
that
yeah.
you see?
Yeah.
Yeah. I mean, because what we do is we see athletes who are busy, right?
Yeah.
So, trying to fit in food in between training. And if they're going to school or they're working,
Mhm.
it's just schedules are hard. And there's appetite swings and
Yeah.
there's all of those different, I know we'll talk about that
Yeah.
a little bit more later, but, that's all really part of the challenge.
Right. I mean, even, high intensity exercise, you may not be that hungry for a while.
Right.
So,
Right. So it's not until you cool
Yeah.
down and rehydrate and then your hunger hits.
Yeah. So speaking of that, what are some early warning signs that athletes, coaches, parents could be aware of to pick this up before it gets to the point where, it's having lifelong impacts?
Sure. I mean, I think that all of those symptoms we talked about, or all of the systems that we talked about, so it can manifest in just fatigue. I mean, the thing is, it is a differential diagnosis. So some of these symptoms that we talk about can come from other things. Like you can have iron deficiency, which is higher in RES, but it's also can happen because of, again, stage of life and dietary intake. So, but you might have fatigue. There might be brain fog. There might be a lot of gastric upset, like constipation or bloating. There could be a lot of breakdown injuries, soft tissue injuries, getting sick more often, not seeing the adaptations from training. So you're working hard, but you're not gaining strength, or your stamina seems to be poor, and that doesn't really track with what's going on. So and then obviously if you have a stress fracture, although a stress fracture doesn't always come from low energy availability, it can come because of footwear or your gait, So that's why it's a diagnosis of differentiation, where you want to kind of figure out what it is. But all of those, and then if there is more purposeful dieting going on, where somebody, because of this diet culture and because of the pressure of all of those things, are purposely skipping meals, avoiding full food groups, following some trends. And you see like a lot of weight swings going on, gaining weight, losing weight, body talk, negative body talk, not eating with the group, with your teammates, or, like will never eat a piece of candy or chocolate or cake or whatever. So those are other things that you just go, that's a red flag.
Got it. So you have to it can be kind of insidious, it sounds like. So you have to really have your antenna up for various
And
symptoms.
sometimes that behavior is almost normalized because we live in this diet culture, or it's seen as being conscientious, and it certainly is seen as being a little more conscientious in males, how it can go longer undetected because like, oh, I'm clean eating. Like,
Oh.
oh, they're so disciplined. Oh, look, when actually it's disordered, right? Doesn't mean they have to have an eating disorder, but it can be dysfunctional eating and not really suiting them.
So can you go into a little more just about eating disorders versus just disordered or inadequate eating?
So as Dr. Casey had mentioned, it can be inadvertent, right? Like you don't have to have an eating disorder to have REDS. Oftentimes REDS is because our schedules are really busy and we just don't take in enough calories, or we think that's enough, and then your hunger hits, and you're hungry again an hour later, but you're in the middle of class or a meeting and there's no food available or whatever. And so it's about sort of recalibrating and thinking ahead and planning meals better, planning snacks better, having them available. But disordered eating becomes where it often starts with dieting, which gets into a whole thing around body image. Like, how is body image related to food and nutrition? And that's because often in this culture of being and athletes, when we'll talk a little bit more about social media later, um, this whole idea of body pressure, of how we look as opposed to how we function, like what is the skills we need in sport, drives people to diet behavior. And that diet behavior now becomes skipping meals, restricting calories. And the more you do that, the more it can affect your brain and these other symptoms, and feeling uncomfortable and getting into a cycle of restriction and binging, or overeating, and can become dysfunctional eating or disordered eating. That doesn't always lead to an eating disorder, but it is a gateway. It has to do with severity, it has to do with frequency, and it has to do with duration. And the level of of how often and how much anxiety or goes into it. I don't know if I
So there's a
put that,
lot of
but
pathways by which you could
yeah.
end up with low energy availability.
An eating disorder in and of itself is sort of a separate thing, but
Mhm.
yes, can result in low energy. But some people with eating disorders might not have low energy,
Mhm.
but they definitely still have dysfunctional eating and issues around. And that really requires therapeutic help. It requires a multidisciplinary approach.
And I would say too, one of the things when you don't know necessarily when you're first encountering and working with an athlete where they fall on that spectrum of inadvertent low energy availability, some disordered eating, behaviors, thoughts and patterns, or an eating disorder. It may not be readily apparent. One of the things that I find, let's say I'm seeing somebody and I refer them to Heidi, she's working with them, and there is a lot of resistance or discomfort around making the changes that she's suggesting. And then you're sort of able to understand, okay, this seems less like in the inadvertent category because we have the information, but it's still a very difficult process. Then you might need to pull in an additional team member where you're working more on the sort of cognitive and, mental piece of the body image and what this means and these behaviors and how it's, sometimes these patterns are serving them in a different way, and trying to figure that out. So it is a team-based approach, which we'll talk about more, but sometimes you see along the course of trying to intervene and treat, where somebody might fall, and it can shift, across a person's, season or career, obviously lifespan too. So trying to sort that out, part of how they respond to some of the suggestions helps with that.
So again, it gets into that, the conscientiousness of being an athlete is like, I've heard this, that I shouldn't eat carbs, right? That and so now with some nutrition education, understanding the role it plays and how their body works, and they're like, yeah, you should be eating. Like, I actually want you before you run to have, 60 to 90 grams of carbohydrate.
Mhm.
And they're like, really? That's great. Cause like,
Yeah.
I tried it. I feel so much
Right.
better. This is working. That was just misinformation and
Yeah.
unguided and not planning or whatever. If someone else is like, I don't know if I can do that. I can't really eat sugar. I think I'm afraid I'm gonna gain weight. There's a little bit more going on. And if even through working through that, they can't. And the other thing is sometimes when somebody's restricting, their brain changes, right? And now it becomes very rigid. There's a rigidity. And sometimes we have to work on being more flexible, even mental flexibility. And it often does spill over into other areas that you can see it, that again, sometimes serves them, especially in sport, but sometimes gets in the way. And that's where if your brain's not fueled, sometimes it's hard in a therapeutic setting to make changes. But then until you can work on some of that mental rigidity and flexibility, it's hard to make dietary changes. And so it's really nice to work together to begin to see a way through.
So, yeah, it sounds
Yeah,
like
adding food and
many times you'd need a psychologist or
Mhm.
someone involved in this as well in these cases.
Yeah.
Yeah.
I mean, I think it's beneficial for everybody,
Yeah.
get this. But
Yeah.
yeah.